Part of public health is this idea called health in all policies. We think about the ways that health has an impact in sectors outside of public health. So, for example, community planning. Designing a community is really beneficial for promoting health behavior.
The essence of good planning is to have a comprehensive plan that's focused on health. One of the things that we do in Hillsborough County in our comprehensive plan is really communicate with the citizens how they want to see their community develop.
Planning and design, how the community is laid out, is important for physical activity and healthy outcomes in terms of people's ability to walk from one place to another, to get around, to make sure that there's enough separation between a road and a sidewalk, that there's enough space on the road for a bike lane so that bicyclists can ride safely. Physical activity is an important consideration in designing and planning a community. It's great to be in a place where it is safe to be outside and be active, get that fresh air and sunshine. That little bit of vitamin D is good for your health. Having a community where you can do those things safely is a great opportunity for good health.
In designing good neighborhoods, one of the beautiful principles is that you have your daily services within easy walking distance. In this community, Winthrop Village, we have the services that we need for our daily needs. We have the grocery store, there's a variety of restaurants, there's a pharmacy, there's medical facilities, there's coffee shops, tailor, liquor store, all the things that most people need on their daily needs.
There is the thought in public health and in planning that what you can do for an 8-year-old or an 80-year-old is going to be beneficial for everyone. So if you put in a crosswalk that has a gradient so that it's easier to move from the sidewalk onto the roadway, that's going to be easier for a child, but also an 80-year-old who doesn't have to step off of a curb. We can help it be safer for people who are 8 or 80 years old based on just considering basic design principles. Design has the opportunity to prevent or mitigate health outcomes, either intended or unintended, that can impact a community. When we build a roadway, for example, that cuts through a community and does not do anything to mitigate for stormwater runoff or noise or air pollution, we're having those unintended impacts on conditions like asthma, and areas that have a lot of air pollution can really suffer negatively. Our goal is to help move people safely through an area from one destination to another. Thinking about how people access goods and resources in different ways is really important to healthy design. One of the other considerations in planning for a healthy community is planning for where we site schools and making sure that they're in areas that are accessible to families, to transit, to kids who are going to be able to walk there or bike there from their homes.
So it all comes back to, design. How you design your neighborhoods and communities to have the full diversity of things that matter to human development. Our homes are not sitting back 50, 100 feet away from the street and the sidewalk. I'm about 5 feet away, so I sit on my front porch, neighbors walk by, we strike up a conversation. We have that good human interaction. That's the connectivity that we have. So we know the kids in our neighborhood, where they are, how they've been doing. If somebody's sick, we look out for them. If somebody's going out of town, we look out for their home. The streets are interconnected. You can move about the neighborhood without having to go out on the main road. You can move around this community through a number of different access points. The design is oriented towards the people. In order to help those existing neighborhoods, we look at redevelopment opportunity. That as things redevelop, we bring the elements that makes that community more balanced. One of the benefits of having good design is creating equity in our community. For our existing neighborhoods, our existing communities, we look at redevelopment opportunities, add sidewalks to those communities so people can move around without walking in the street. Healthcare, food, not creating food deserts. Middle-income communities, low-income communities, even high-income communities have the ability to have all those things right at their fingertips and not be isolated. It's not just all single-family homes separated away from businesses. We need to have that equity in our community, and having that balance is created by having a design that creates those things.
Design matters for healthy outcomes because we can't do this alone. Public health can't do it without our partners. Design can help us stay active, whether we're 8 or 80. We can give community members the opportunity to be healthy through making where we live, work, learn, and play safe and healthy for everyone.